I just want to say how honored I am to receive this. It came as a complete surprise to me, and I want to thank you very much. I've been here since 1994. I came here as assistant professor of medicine and general medicine. In 2018, I was a hospitalist. And I was doing straight inpatient medicine for 5 years. And what I was seeing was a significant minority of patients who would come into the emergency department. They would be seen in the emergency department and sent out with a prescription or whatever, see your physician. And these were patients experiencing homelessness. So I was taking care of a patient on the sixth floor over at Upstate. The guy was in there for IV 6 weeks because we couldn't get the guy out to a place because he was a heroin addict. So none of the services, home services, would take him for IV antibiotics. So he was stuck on the sixth floor, wasting the nurse's time, wasting the
Right.
patient's time, my time, all this stuff going on, and the amount of money that we're spending is the least of it. It's the poor service that we were providing to this poor guy. So I said, this is BS. I got upset. And I'm mindful of a saying of St. Augustine, who said that hope has two beautiful daughters. The first beautiful daughter of hope is anger at the way things are. And the second beautiful daughter is courage to change things. I dropped my practice at the hospital completely and just decided to go into the streets and under the bridges and that start treating people. So I've been out since 2018 doing this kind of shtick. I go out with John Tomino and In My Father's Kitchen, who's a very wonderful partner with me. We founded Housecalls for the Homeless. It's an upstate program. I've been draining abscesses frequently. I do it on the street. I've got a go bag that I go out with. The Upstate Inpatient Pharmacy and I have worked on an arrangement where they count the drugs. They give me the meds front loaded with a patient name, but I've got baggies of clindamycin and Bactrim and all the different types of frontline antibiotics that I would need, as well as antihypertensive, amlodipine,
Uh-huh.
inhalers. There are people that are experiencing homelessness. They're trapped in addiction. 50% have a bona fide psychiatric diagnosis. Trying
Okay.
to getting them into psychiatric care is a whole other issue. In addition to providing frontline services for the acute medical types of things, I've been able to use services like Molina and other providers that can get these guys on Medicaid. There's not a barrier to getting them insurance. 80% of these guys have insurance, no problem. They don't have a doctor. It's a square peg, round hole thing. So the structure in Syracuse is like every other place, is that we have a construct where you have a clinic setting and you got the patients come in and da 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 da. You see them, the nurse triages, et cetera. This isn't that. And so providing medical services directly and having the physician there with the patient, all I got to do is I got my hotspot with my computer and I'll send electronic prescriptions all over
Uh-huh.
the place. And we also have a very good relationship with Upstate Outpatient Pharmacy. We have an account there through our foundation that we've been able to raise money that will cover all expenses for free drugs for people that aren't insurance or any uncovered medicines. When I started the program, we fundraised with my initial thought of it being, I'm going to need a lot of stuff, a lot of support financial wise to getting meds for these guys. Because I've done a fair amount of work in Haiti and India, Nepal, Ecuador, Puerto Rico, and other places in Kenya. I kind of patterned this after that. So in those places, you had to provide all the drugs to the person, and they fundraise to get the meds. And the other big thing I see on the street is toothaches. What would happen is I would see a tooth abscess and I can get them on Clinda and get them started up. And then the dental thing is a big problem, getting them into the dentist. And a lot of these guys are trapped in the addiction, trapped in the psychiatric stuff. So this one person, this 30-year-old woman, I started her on Clinda for a toothache, and we had her set up with a dentist at the time. We were able to kind of beg and plead with a local dentist who was really kind to us to help us. She it wouldn't go. She wouldn't didn't show. We drove her to the appointment. She jumped out of the car one time because she had to score. And so I treated her 3 times with Clinda. And then the last time she was lost to follow up. Next thing we know, she's in the intensive care unit at Upstate because she had necrotizing fasciitis that tracked all the way down from one of her molars through her neck, fascia, into the pericardium. She coded. She died basically. They brought her
Yeah.
back with a pericardial centesis. pull the pus out. So we been partnering now with a great dentist in the community, Michael Romano out of Summit Dental Group. We got an arrangement with him that acute dental issue, abscess, not screw around with it, get them in. We've got a nice fast track. John Tamino's crew will go out with these guys, get them to the appointment, sit with them in the office, do the thing, and then get a treatment plan for dental. That's pricey, and so that's our next fundraising thing is for hitting up various places, Dental Association, other good fundraiser givers to give to Housecalls for the homeless. So it's Housecalls for the homeless, and it's with the Upstate Foundation. Donations are greatly appreciated because they'll go to this we're targeting this dental thing as our next big deal, and it's several thousands of dollars. This one patient we have got a beautiful newsletter with a guy with no teeth and a guy with full teeth, and now he's connected with his family. He was really stigmatized and felt terrible about not seeing his kids, and so he's now reconnected with his family because he just feels better about himself with his teeth. I've been vaccinating these guys for COVID ever since last April, and we've had a really good turnout. And then the last thing is I've started to give bridging therapy with Suboxone for heroin and fentanyl addiction, and we've had some really good results with that. And I've become a true believer in it because even if there's some diversion with it, I realize that for every 3 new prescriptions of Suboxone, you save a life from heroin or fentanyl. I've got a thing in Epic in the COVID mobile immunization clinic under the auspices, but I do everything else under it, not just COVID. Several times a week, what I'll do is I'll take first and second year medical students with me. I'm trying to get them young before they get jaded and get in bad influence, and they can really see this. And I have them with me, and we've had some really inspiring stories, and they seem quite motivated. So that's important for the next generation.